Across Canada and here in British Columbia, January 18th to 24th has been proclaimed Environmental Health Week by the Lieutenant Governor. This proclamation recognizes and celebrates environmental public health professionals like Northern Health's certified environmental health officers for their efforts in protecting the health of British Columbians. Today we speak to a couple of environmental health officers to find out just what those efforts entail.
The core services provided by environmental public health professionals are essential elements in building a healthy population, including food safety and hygiene, drinking water quality and recreational water quality, indoor air quality and outdoor air quality, community sanitation, and environment management. In the province of British Columbia alone, there are over 300 environmental health officers working to protect the health of British Columbians. Our professional body, the Canadian Institute for Public Health Inspectors, is responsible for certifying environmental health officers in BC and throughout Canada. Many people do not realize the diversity of our profession, so we're here today to touch a bit on that. BC environmental health officers regularly inspect small rural and large urban waterworks systems to ensure safe and potable drinking water for the public. As environmental health officers, we play an important role in the review, approval, and routine inspection of foods that are sold to the public at farmers markets, craft fairs, and as well as special events. So environmental health officers also respond after winter floods and windstorms to ensure community water systems and local food supplies remain safe. So, for example, when many homes were affected by the ice jams and the flooding of the Neelam River back in 2007, environmental health officers were involved in providing advice on the best ways for homeowners to clean up after a flood or disinfecting their well water after it may have become contaminated. Environmental health officers also inspect personal service establishments such as hair salons and barber shops, to tattoo parlors and body modification establishments. So in these establishments, we're concerned about the infection control practices and the potential spread of communicable diseases. So we work to educate operators on proper disinfection and sanitation of their equipment in order to prevent the spread of bacterial, virus, or fungal infections. We also strive to educate the public on questions to ask and what to look for when they choose personal service establishments, and that if they note any health concerns, to report these to your local environmental health officer.
Of course, that's not all EHOs do here in northern BC. Joining me to share some other aspects of the Public Health Protection Program is Environmental Health Officer Jim Green.
Well, we are consulted on subdivision applications, and inspections are carried out on-site to verify the information that's provided and ensure the lot's topography and soil structures are likely to be able to support a septic system. Water systems, large and small, for communities are approved and permitted by Northern Health. This ensures that the placement of the wells or the source and the construction is adequate, and treatment facilities are provided to ensure that potable water is provided to the residents. Routine inspection verifies that the system on an ongoing basis is properly maintained and operated, and regular sampling is required.
Do you regularly deal with other sewage issues?
We do respond to sewage system complaints on a fairly regular basis and enforce regulations requiring compliance and corrective action to ensure that neighboring wells and vulnerable environments aren't affected. Disposal fields fail for many reasons, and lagoons have their own issues, and neighbors can be impacted, and immediate repairs are often required. Homeowners generally do comply because they're also fairly seriously impacted with sewage failure, but our progressive enforcement process enables us to issue an order if it's required to ensure that timely repairs are completed.
So public recreation, swimming pools, and hot tubs are also inspected. What are the requirements to ensure they meet the safety needs of swimmers and bathers? Automatic
filtration and disinfection protect us from sharing our own individual health issues with each other in otherwise warm and protective pool environment. Bather sanitation and sanitation practices throughout the facility further removes disease-causing organisms from the pool environment. Inspection of water quality, treatment and disinfection equipment, and the facility in general help us to ensure that the necessary protocols are implemented and properly carried out to ensure that the basic barriers are in place to protect us.
What role do environmental health officers play in cases of diseases that can be spread through food, water, insects, or animals?
Well, most of us have probably heard of Listeria, E. coli, Salmonella, and norovirus. These are just a few of the microbes associated with gastrointestinal illnesses, often carried through food and water supplies. Over the past year, we've seen a number of individual cases of a variety of these microbes, and some outbreaks where up to dozens of people have fallen ill. We conduct communicable disease investigations on all reported cases in order to establish a specific event or causative agent that might be the source of the outbreak. We contact others who attend the event in order to identify specific attributes to the outbreak. And we try to trace as many of the contacts as possible so that we can discuss necessary personal protocols to protect them from further sharing the outbreak with family and friends. We found that foodborne illness is grossly underreported, and illness isn't normal. There aren't a lot of things that will make you lose your lunch. In fact, it could be your lunch, but more likely it was something that you ate or drank as long as a week or more before you were ill. So it's important that you see your physician regarding a tummy bug and report it to public health so that we can take the steps necessary to find out if we have an outbreak, compare the information with BC-CDC to ensure that it isn't a broad-based outbreak like the Listeria issue of last year. And we can take corrective action and put an end to the outbreak as soon as possible.
In addition to all of this work, environmental health officers also inspect restaurants so the public can be confident their health is protected when they enjoy a well-deserved meal out. You can view reports from those inspections. Just visit our website at northernhealth.ca and click on Inspection Reports. For Northern Health Highlights, I'm Erin Collins.